So again, with this mass, because it's over the metacarpal joint, we're going to debulk it. So we're actually going to go through the mass itself and then try to laser ablate the base. But again, I didn't want to totally resect it, leave an opening that I'll have to suture, because this is just too difficult an area post-surgically to keep them immobilized, and probably have some complications associated with it. So here we go, we're kind of cutting through it. So here, my options with this now that I've got it out, is to just ablate the base of it. And because we're using laser, the benefit of it is that it should cap off nerve root endings for us. So it should minimize any post-operative sensation that this dog may have. So what we're using right now is a 6mm coagulation handle. And as you saw, we removed the mass earlier, but I didn't want to leave a stitch in there. So what we're doing now is we're actually using the coagulation handle to shrink the size of this area, which it's doing quite nicely. And then also to provide some hemostasis. So I'm going to hit the edge a little bit more, just because that's just in case there's some germinal cells at the edge of the mass. But as you can see, that closed up beautifully, barely leaving any exposed tissue right there. So that's going to create a nice post-operative wound that we really don't have to worry so much about. Again, because the laser will cap off the nerve root endings. We've got some great coagulation here and hemostasis, so we don't have any inflammation there. And then it'll actually improve the wound healing in the area as well, because we've basically vaporized any bacteria that might interfere with wound healing, etc.